Basically, it's kind of self-explanatory, something I've covered before, but one of the first things, this is Zoom rules in regard to speakers. Obviously, don't interrupt the speaker when he or she is presenting. When the speaker is presenting, kindly mute your microphone. And this is something we've found that if you don't do it, people are talking in the background, or, the phone's ringing and that kind of thing. So obviously muting depends on what type of computer or whatever you have. So you just have to find out how to do it on your particular device. Only unmute your microphone if you have a question or comment for the speaker. And then, of course, respect the speaker, respect other members when they're speaking, and not interrupt them, of course. And I think that's it.
Great job, Cheryl. Should we go around the room and introduce ourselves, or should we do that later towards the end of the presentation?
We can do it now. Go ahead, Cindy.
Okay, well, I'm Cindy. I'm the president of the Fibromyalgia Support Group. I've been in charge since summer of 2020, so like in the midst of the pandemic. So, so it's a really good experience being with a good supportive group like you guys. And I have fibro for a long time, probably my mid-20s, and I'll be 38 next month. So I've been dealing it for almost 11 years. So it's just frustrating, but I'm glad I found a group like this that I can talk to and get support from. So, and that's me. So I guess Cheryl, you can go next.
Yeah, I'm Cheryl, and I'm the vice president, along with Cindy is doing an awesome job as president. I've been in the group for many, many years. I can't even remember when I joined it. I've had fibro probably around 27 years or so, maybe a little bit more than that. Maybe I had it and didn't realize I did, but I try to use more natural treatment for the fibro. We just like walking and doing everything like that, because I just have such a reaction to many of the meds, and I'd rather not mess around with them. So so far so good. There are days when it's really bad, and some days it isn't so bad. So anyway, that's me. And we can pass it along to the next person. Well, Kelsey.
Hi,
Hi.
I'm Kelsey. I'm actually my physical diagnosis has only been for like a year. But I've had a lot of the fibro symptoms for quite some time, just with it kind of escalating. Yeah, so just trying to learn what works for me, and kind of take a pretty balanced approach to how I'm trying to manage symptoms. I actually recently got diagnosed with EDS, the hypermobility type as well. So just trying to learn about my body a bit more. I really appreciate having the support and finding other people who have fibro. So yeah, glad to be here. Thanks, guys.
Well, I guess maybe Janet can go next, or Beth, or Ron, whichever.
I've had fibro. My name's Janet, and I've been with the group for about 20 plus years. I've taken some of the meds for fibro, and I too feel like if it's you can do it naturally with turmeric or some of the things, the anti-inflammatories. I have hypermobility, and I'll be concerned. I'm kind of wondering what Dr. Houdek has to say with MSM eye drops for dry eye, and OCLUMED as a secondary drop to put in an eye. I still have the dry eye. I'm getting the plugs every 3 months or whatever, but you know what? I was 3 months up on this when I had to do all this stuff with the aspirin. So I'm kind of wondering whether, that had a trigger for my red eye too. So, but I'm very happy to have a group to go to and people to talk to and have all the doctors and things there with our group. I think we get a lot more than sometimes our internal medicine doctors can give us. And I'm even dealing with U of M. So thanks again, everybody.
Let's see if I got the mic. Sounds like I do.
Yeah.
My name's Ron Messick. I've been diagnosed for 26 plus or minus 1 years. Currently on disability and dealing with all the Social Security rigmarole. Let's see what else. Engineer by trade. I've done fractional factorial analysis on a variety of treatments and protocols over the years. That's enough. Next.
I think maybe Mary. you
Yeah,
were done.
well, maybe I guess I'm up. You caught me with my hair not dry, so. But anyway, so I've been with the group. It's hard to remember actually, maybe 12 years or something. And a friend of mine is the one actually told me about it. She wasn't a member, but she had heard about it or read about it somewhere. So I was really glad. I went through a lot of bodily symptoms that were so strange and I didn't know what was wrong with me. And sometimes I could hardly get out of a chair and it was really pretty awful. And eventually I got diagnosed with one thing and then it was another, but I guess basically I have fibromyalgia and then I do have an autoimmune disease. I got Sjogren's syndrome. I was diagnosed with that not too long back. So anyway, I'm happy to be part of the group and I'm glad to be able to talk to other people who are in similar situations because sometimes people don't even know what fibromyalgia is, which surprises me because I think, well, I think it's well known, but that's the way it is. So, and I think, we have a good vice president and president, so I'm happy about that. So that's enough about me.
For a minute, I was wondering why you're bringing Kamala Harris into this.
So we're up to me.
Oh, I meant, obviously Cheryl.
Yeah, it just took me a minute and I thought it was humorous.
Yeah, it took me. I wasn't sure who you were addressing it to. Yeah.
Oh, like Ron.
Yeah,
likes
you're
to
right.
joke around.
Believe me, I wouldn't be bringing them into this, believe me. But that was a good one.
It took me a minute. I have to say I'm brand new to the group. I do not have fibromyalgia, but I support several people that do. And so Cindy's information is awesome. I'm glad that I get to be here today because I've missed so many since she and I connected. I'm in Canada, so some of those political jokes go, I'm an American living in Canada, so they kind of go over my head, but don't. But yeah, that took me a minute there, Ron. Yeah, no, I'm thrilled to gather the information and be able to share and serve however I can to the people in the group. My daughter her name is Kelsey, so it was kind of fun. Kelsey, when you came on, looks to be that she's about the same age and has she's not officially diagnosed with fibro. She's got so many other diagnoses. But she is one that I support specifically, and my stepmother as well. And my stepmother's availability and willingness to do lots of research and Zoom calls is minimal. So the ability for me to gather the information and funnel it to her is quite important to me. So I'm glad to be here.
Glad to have you, Beth. I think there's one more person that popped in. I'm not sure what your name is, dear. I know the screen name is Motorola 15G Ace. I think you're muted.
Yeah, muted.
Yes, it's Deb. Hi, Deb.
Oh, hi, Deb. Sorry, I didn't recognize you.
You have to unmute. Do you have the thing on mute?
Sure. Okay, is that better?
There you go. You got
Okay.
it.
How you doing, Cheryl? Why am I getting? Okay. All right, now Cheryl is muted. I can't hear her. I don't know if you guys can hear me or not.
We can.
Oh, okay. All right. Well, Cheryl invited me because we're sort of friends in a morning group that we go to, and she sort of happened to hear me mention or something that I have fibromyalgia, and she goes, well, so I'm trying this out. I don't have a lot of time today. I got some issues I got to take care of with my husband and stuff, but I wanted to pop in and say hi and say I'd like to, you know, join and pop in when I can. And it's sort of good. Like you said, fibromyalgia you think is, you know, pretty well known, and isn't. And so people don't understand what you're going through.
Okay, I guess we can start. Thank you, Deb, and welcome to the group. I know that all of you guys know Dr. Houdek. He works in Westland, so he spoke to our Fibro group many times in the past. So, Dr. Houdek, it's a pleasure to have you, and thank you for coming. And I think pretty soon we'll be running out of time, just so everybody knows. But we'll try to make it quick, and we have 3 other sessions, so no worries. So take it away, Dr. Houdek.
Well,
And
thank
I
you.
wanted to remind everybody to mute. Like, right. Thank you again. Sorry.
No, that's okay. So thank you for having me again. You know, it's been a couple of years since we weren't able to do it last year. But what I was thinking about doing, you know, we've talked about a lot of different things, but I was going to go on now. A few new drugs, 3 new things have come out over the last couple of years, and I was just going to kind of go over that a little bit, kind of quickly here. And next session we can start talking about those a little bit more. But one of the newest drugs for treating dry eye is Trivava. Okay, it's Tyrvaya. It's a nasal spray, actually. And what it does is one spray in each nostril twice a day. And what it does is stimulates what we call the trigeminal nerve, which causes you to tear, and it increases your basal tear rate. We had a product before that was a little device that put an electric shock in your nose. That was about 4 or 5 years ago, and it didn't really go over big. So they were trying to figure out some other way to do it. So they've come up with this nasal spray, and it's working out pretty well. We've just started using it about 2 months ago. And we have a few people that say it's working pretty well. Just spray, and you will tear. Not sure if you knew about this one. Another drop is called Lumify. Now, this is an over-the-counter drop for redness. There's a lot of drops out there for redness. I am not crazy about getting rid of redness in the eye by using an anti-redding agent. All the Visine, Murine, they have a lot of other side effects that we don't like. Lumify is special in that it only works on the veins. It will only decrease the size of the veins, not the arteries. So we want the arteries to keep flowing blood because we want to get blood to all the tissues. Okay. And normally, probably 90%, 95% of the time, it is the veins that are too large. We want to cut those down. Now, Lumify is actually over the counter. And you can use that. It should do 1 drop a day, maybe 2 drops a day is all you need. And it works great for redness if you just need something temporarily. Another drop, and this is for allergy, is Isuvis, and EYSUVIS. And this is actually a very weak steroid drop. We have another one very similar to it called Alrex, ALREX. Both are very similar. You use these drops 1 to 4 times a day, and it reduces inflammation that causes dryness or redness. We normally use those temporarily. Some of the other drops that we use will a little more often. Another drop for allergy, if you've heard about that, probably is Pataday. Now, Pataday used to be prescription. And about 2 years ago, I'm not sure if we talked about this before, it is now over the counter. It's actually kind of interesting is when it was prescription, it was one of the most prescribed allergy drops on the market. It's now been on the market for 15, 20 years and it's over the counter. There's actually 3 different formulations of it. And they do it in a red, blue, and green, or blue, red, and green. The blue is 0.1%. The red is 0.2%, and the green is 0.7%. So it's all the same drug, just little different strengths. And you use the drop once or twice a day. Again, that's over the counter, and that works out pretty well. One of the newer drops we've had this probably since I think September, October last year, is a drop called Upneek, UPNEEQ. This is to elevate a droopy eyelid. And actually it will work on the eyelid, not on the skin that some of us have with this loose skin here, but it will pick the lid up. It works on the muscle that makes the lid come down. So it stimulates that and the eyelid opens up. So I've had some people that said they were thinking about getting surgery for their eyelids. And what I've said is, hey, use this drop, let's see if it does anything. And some of them have said, hey, I don't need the surgery, I'll just use the drop as necessary. Other people have used it and said, yep, it works, let's go get the surgery, since you know that that can help and I don't have to use the drops all the time. Side effects are very, very low. Sometimes a little bit of dry eye, sometimes red eye, but most people are pretty happy with it when it does work. If it's just the loose skin, it won't take care of that. It works on the muscle. The newest drop, I'm not sure if you've seen Good Morning America, one of the morning shows, is called Vuity. Now this one's a brand new within the last probably 4 weeks. It's a drop to increase your depth of focus, to reduce the need for reading glasses. So what it does is it makes your pupil in your eye very, very small, and then your increase of depth of focus that you get. Now, it's recommended for people between the ages of 40 and 55 that are having some issues, but that's just it. We're brand new on it. I was at a seminar last night with one of the researchers, and they said we just had to come up with something because the FDA said we had to come up with something. And so they haven't tested anybody else, but they said they can't see why it wouldn't work on anybody else. Way back when I was a little kid learning all this drop is called Pilocarpine. We used to use this at a percent rate of 4% for glaucoma. And I was always amazed when I was coming out and we're getting 80-year-old people that can see distance and up close and there's no glasses because they're looking basically through a pinhole. And if you look through a pinhole, you can see really, really pretty sharp. Now you do lose a little bit of that peripheral vision on it. But this one is it's not 4%, it's 1.25%. And so it doesn't affect, it makes it smaller, but only about half as small, not real small. So you can still have distance vision, but we kind of recommend, we're going to say, don't use it if you know you're going to have to do anything driving, especially at night or in the dark. Right now, it's only recommended to use it once a day, and it lasts for about 6 to 7 hours. It's a prescription drop, but it is not covered by any insurance. That's the same thing with Upneek. It's a prescription drop, but not insurance because they're both cosmetic. Now, we'll go back to Upneek is about $120 for a 1 month supply. And the Vuity, the new drop coming out, is about $80 for a 1 month supply. And also there's another one. If you've heard about Latisse, this makes your eyelashes grow thicker, darker, longer. That's been out for a few years now though. But it's actually, they found out it's the side effect of a glaucoma drop. And there's a glaucoma drop that makes your eyelashes grow thicker, darker, longer. And what they did is just rebranded it and made it pricier for people. And So like you can get the glaucoma drop for $10 a bottle. This is about 120. And saying, so you have to have, if you have glaucoma, it works great. You know, you only pay $10. But that's out there. One of the new one, it kind of new, is called Elidel, used for allergies, but it's more of a cream for around the eyes. It does have some side effects. It's a non-steroidal, which is nice, but it does have some side effects with it. A lot of times what I like to use is something called Lotamax, which is a mild steroid cream that we use. And the nice thing is if you get Lotamax in your eye, it was designed for the eye. Actually, we use it off-label on the skin around the eye, and it works very well. So if you have some like atopic dermatitis, allergy, redness, we'll prescribe that, because if you get it in your eye, we're okay. Sometimes people will say, well, what's over the counter? At most you can get 1% hydrocortisone cream. It's a little ointment, and you put that around, but you don't want to get that in your eye. Okay. So those are the kind of quick, just some of the new stuff that's on the market right now. I think we'd have to go to a session, change sessions here pretty quick. But when we start that session, if you want to, we can kind of open it up right away. If you want to talk about any of that, or I can get going and talk more about some dry eye and some of the all new different testing techniques that we have for that. So any questions now, if you want to open it up?
I had one question, Doctor.
Sure.
Could you give us the name of the one about the in-depth vision? How do you spell that one drop?
Vuity, V-U-I-T-Y. It's like kind of like View IET.
Oh, okay. So okay. And the one before Matisse, I think there was another one that you mentioned right before that one. I didn't get that one down.
Tribalia.
Yes.
T-Y-R-V-A-Y-A.
Okay, thank you. And speaking of
That's
that,
the nasal spray.
and now that you mention it, with the running out of time, it popped up on my screen, and we
Yep.
have 10 minutes left or less. So
Oh, okay.
we can answer some more questions if you like.
Sure. Any questions about any of those, or do we have?
If you'll excuse me real quick, I've got to bow out. I got to go for an appointment, but I'm glad I came, and I'll be joining again. Thanks, everybody.
Thanks for having you.
Thank you, Deb, for popping in. Nice to see you.
Okay, thanks. Bye.
Bye-bye.
Bye. Tell Ken hi.
I will.
Thanks.
Bye.
I had a question for you. So I had amblyopia when I was a kid, and I had the surgery for it on my left eye. And now I get migraines all the time with this eye. I've gotten like nerve blocks like up here before. Is there anything, I guess, like from your scope that, you see with like fibro patients, and whether there's more like eye issues, how you tend to handle that, etc.?
Great question. And with that, with fibro, a lot of times fibro, and as everyone knows, is going to have problems on the muscles. Same thing with the muscles for the eyes. And if you've had surgery before, the surgery can actually has little scar tissue, and sometimes and especially now that we're doing a lot more close work, we're on our phones all the time, we're on this equipment all the time. That's what stresses the eye. I tell people we call it close work. We don't call it close play. And the things that we are working the eye muscles, and they will fatigue quicker. So with people that are having problems with that, a headache you could be getting a little, not quite double vision, but almost double vision. And that's very disturbing. And I tell people when I show them, I kind of like look at this and I say, you can see one hand there, you can see two here. But if you do this and you just start going like that, it's not two, but it's not quite one, but it's not really clear. And you're not sure which eye you're supposed to use. And that's just, it's a headache. And so we do a lot of what we call prism glasses. And you put prism in the lenses to realign the eye up so that two eyes are lined up together. That's a possibility that that could be causing it, or just a slight change in prescription. Even though you're really young, there's a new lens on the market that we've been using called the Eisen, Eyezen. And I tell people that I think the reason they called it that because it's very relaxing. And after you use it for a while, you just sit there and you go, that's how they get the Zen in it, I think. But it's actually, what it's doing, it goes out 360. It's not quite a bifocal, but as you go from center out 360, the power lessens. So it makes it easy on the eye. And what we've found out, and we've known this all along, when we're doing all your 1, 2, 3, 4s, driving you guys nuts trying to figure out what your straight ahead prescription is, your outer prescription is not the same. And we've known that forever. We just didn't have technology. This is the new technology. And I give it to kids, I give it to teens, I give it to 20, 30 somethings. And it's what's really scary with this is it's working very well. I mean, we're getting kids that they're diving in their prescriptions, and I've had them in it for 2, 3 years, and there's no change in 2, 3 years. And it's just like, wow, this is really working well. And I give it to 20, 30 somethings, and they say, I just don't feel as fatigued at the end of the day. And I said, that's the whole point. And maybe that's where they do get their Zen from. So it relaxes the eye, plus it has blue light block in it. Now, if we look at the medical research on it, medicine has come out and said there is not enough blue light coming off of any of our devices to harm our eyes, which is excellent. It's good to know that. And that's what I say, hey, fantastic for that information. We know our eyes are not going to blow up. They're not going to fall out. They're not going to disintegrate. But visually, it's going to be a whole different ballgame. And blue light visually can create strange stress, and that can create something. So this automatically has it in it, and it works very well. It's like everybody's that's coming back. We keep them in it. We don't take them out of it. They like it. So that's another option that you might need something a little bit.
I appreciate that. Oh,
Is the exam the same?
The exam's the same. We just do the exam, and what we do at the end is prescribe that lens. And mine is almost automatic. If you're under 20 years old, I almost automatically say everyone should have that. That's the way the eyes have been designed and built, and we've known that. There's no reason why you shouldn't get it.
Is that something usually that like insurance will cover, or does it kind of depend?
No, well, insurance will cover. They'll say they'll cover a lens. It's not considered a bifocal.
Okay.
That's not a covered thing. If they have a tint, they'll cover. You can say, well, it has blue light block in it. Depends on your insurance.
Yeah, these actually, the ones that I wear right now have blue blockers, and I still get all sorts of sensitivity. I wear like sunglasses driving, and I don't know. I've talked to someone about the prisms too, and they said at the time that I wasn't a good candidate for them, which I thought was interesting. So I don't know.
Yeah, I test prism on everyone, and it's a little prism can go a long way. And when I take prism, I put the little prism in front of the eye. I have people look straight ahead, and I put it in front, and I said, let me know if it makes any difference. I say that, I'm kind of sort of listening to them, but I'm looking for their facial reaction and how they react to it. So if I take and I put a lens in and they go, do it again. I think it helps. You don't get it. If I go like this and they go, wow, it's automatic. And it's almost on that very first time you put it in, it's there, and it really helps when you do that. And it's very little that you have to have. But again, during our regular exams, we're testing for that. That's just a normal exam that we do. Part of our exam, we want to make sure both eyes work together as a unit.
Okay. Thank you. I appreciate that.
You're welcome. Any other questions?
I think we're down to 3 minutes, so I guess we have time for 1 or 2 more questions. Or unless you guys want to meet for number 2 and then answer more questions there.
I just have a quick one.
Oh, sure. Go ahead, Cheryl.
I had LASIK probably 20 years ago. And besides having dry eye, I also have glaucoma, which I take Lumigan. So that's why my eyelashes are kind of long, because it kind of works along with that whole thing. But I find that when I'm in a dark room with after having LASIK, I haven't had to use glasses at all, because I have one for close and one for far away. But I find like we went to see a play the other day, like far away, people are like, it's like double. Like I can see the side of their face. it's like almost like not quite double vision, but
Yep.
I don't know if that goes along with the LASIK itself, or is there anything I could do to correct it other than getting glasses, which I really don't need.
Yeah.
But it's frustrating when I look at the moon,
Right.
Full moon, I'll see part of the moon
The
on the
shadow,
side,
yeah.
just, is
So
that
that's what I-
common?
Yeah, that is common. It could be a couple of different things. One, with the LASIK, there are what we call higher order aberrations in the tissue that it can create. So instead of getting a nice, perfectly round image, you'll get just kind of like a little glare to the side.